Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Welcome to the Friendly Pharmacist podcast. I'm Nario Cantu, your host and pharmacist at Cantu's Pharmacy. Today, we're diving into a topic that's been at the forefront of healthcare discussions over the past few years, long COVID. We've all heard about COVID-19 and its devastating impacts, but for many, the battle doesn't end after the virus leaves the body. Today, we'll explore the ongoing research into the long-term effects of COVID-19 and some of the emerging management strategies for those experiencing persistent symptoms. First, let's talk about long COVID and what it really is. Long COVID, also known as post-acute sequelae of COVID infection, refers to a range of symptoms that persist weeks or even months after the acute phase of the infection. These symptoms can vary widely, but common ones include fatigue, brain fog, shortness of breath, chest pain, and joint or muscle pain. In fact, some people who had only mild symptoms during their initial infection have found themselves dealing with a new and persistent set of health challenges long after recovering from COVID-19. What does the research say about long COVID? Ongoing research into long COVID is uncovering valuable insights, but there is still much to learn. According to recent studies, approximately 10 to 30% of people who have had COVID-19 experience lingering symptoms. This includes individuals who were asymptomatic or had mild cases, making it a widespread issue across all demographics. One area of focus is understanding why certain people develop long COVID while others recover fully. Researchers are investigating a number of possibilities, including viral persistence. Some studies suggest that remnants of the virus might linger in certain parts of the body, like the lungs or brain, continuing to trigger an immune response. In some cases, the immune system may go into overdrive, attacking healthy tissues in a phenomenon similar to autoimmune diseases. COVID-19 is known to cause widespread inflammation, which can damage various organs and systems. This inflammation may continue even after the virus has cleared. The virus can affect blood vessels, which may explain some of the cardiovascular symptoms seen in long COVID. Research is still in its early stages, but global efforts are underway to better understand these mechanisms and develop effective treatments. Let's talk about symptom management. What can we do? Managing long COVID is a challenge because no one-size-fits-all approach exists. Treatment must be individualized based on the specific symptoms a person is experiencing. Let's take a look at some management strategies that are currently being used. Many people with long COVID report severe fatigue that can make daily tasks feel insurmountable. One of the most important strategies here is pacing. This involves carefully managing energy levels and avoiding overexertion, as pushing too hard can lead to setbacks. Health professionals often recommend techniques like the spoon theory, where patients learn to balance their energy levels by thinking of each task as using up a limited number of spoons of energy. Respiratory symptoms are common, even in those who didn't initially experience lung issues. Simple breathing exercises like diaphragmatic breathing or using a resistance breathing device can help improve lung function over time. Cognitive dysfunction, often described as brain fog, can be frustrating. Experts suggest a combination of cognitive therapy, brain exercises, and even lifestyle modifications like better sleep hygiene, stress reduction, and proper nutrition to help clear the mental haze. Since COVID-19 can affect the heart and blood vessels, managing cardiovascular symptoms is critical. This might include medications to manage heart rate or blood pressure, or engaging in light physical activity like walking or yoga to gradually improve cardiovascular endurance. Mental health support, anxiety, depression, and even PTSD can develop in people who are dealing with long COVID. The ongoing stress of managing a chronic illness, especially after an acute viral infection, can be overwhelming. Mental health professionals are key partners in helping people navigate these challenges, and there are various options for talk therapy, medication, or mindfulness practices to reduce anxiety and improve mental well-being. Multidisciplinary approach, given the wide range of symptoms, it's clear that treating long COVID often requires a multidisciplinary approach, a combination of healthcare providers, such as pulmonologists, neurologists, cardiologists, physical therapists, and mental health professionals, may all need to work together to provide holistic care for these patients. Let's now discuss the importance of vaccination. While vaccines do not eliminate the risk of contracting COVID-19 entirely, there's growing evidence that vaccination reduces the risk of developing long COVID. Some studies have shown that individuals who have been fully vaccinated and still get infected with COVID-19 are less likely to experience prolonged symptoms. This makes vaccination not only a public health priority for preventing the spread of the virus, but also an important tool in reducing the burden of long COVID. As research continues, we expect to learn more about how to treat and, hopefully, prevent long COVID. There are ongoing clinical trials aimed at finding effective therapies, including anti-inflammatory drugs, antiviral treatments, and immune-modulating therapies. The more we understand about the mechanisms behind long COVID, the closer we get to targeted treatment. In the meantime, it's important to raise awareness of long COVID and its potential impact on individuals and the healthcare system. Patient education, ongoing research, and compassionate care are key to helping those affected navigate this difficult condition. That's all for today's episode of the Friendly Pharmacist Podcast. If you or someone you know is dealing with long COVID, know that you're not alone and there are resources available to help. I encourage you to reach out to your healthcare provider or visit us at Cantu's Pharmacy to discuss management options. Thank you for tuning in, and until next time, stay well and stay informed.